We're in a crisis. There's lots of people out there that need lots of help.
Everything's bigger and better in Texas, but when I look at the fact that 21 rural hospitals have closed in the last decade, I think about the administrators that are having trouble sleeping, thinking about how they're going to keep their doors open in their hospital to provide care to their community.
Well, I was a 20-year alcoholic and a methamphetamine IV user. I finally had had enough. I was suicidal.
About 10 o'clock in the morning, a mother who was 27 weeks pregnant drove to our hospital in San Augustine, Texas. And on arrival, she was in crisis. She began to bleed and her pain increased. And she had a high-risk pregnancy. It was a really scary situation for everybody.
My inner world before meeting Tracy was crazy. I was not the same person at all. Tracy, as my MP, helped me to see that I was being my own worst enemy. It didn't have to be that way, that there were things that were lovable about me.
It is an honor to hear you say that.
It just was more comforting to me to know that Elizabeth was there and she was nearby and she was going to take care of me. One time I was running down the ramp to rescue one of my dogs and I slipped and dislocated my collarbone. She got me through a bunch of injuries, so to get the kind of care that you felt like you needed and then find out that there was care you didn't know you needed and to get that as well. It was most excellent, and I got most excellent care from this woman here.
There was a potential for both of these patients, the mom and the baby, not to survive this. And we had to act quickly, utilizing the training and education and knowledge that we had to make a difference in these people's lives.
It is always looming in the back of my mind. It's the fear. If I don't have my collaborating physician, I'm not able to take care of my patients, and we are in a crisis.
Nurse practitioners are wanting to move into rural health, but a lot of this delegation agreement and having to have an agreement with a physician that could be 100+ miles away, it's too expensive and it's restrictive.
Everything we do is to help people survive, and to even think about somebody pulling up to a hospital and it's closed and the outcome being that mom and baby may have died. That's just scary to even think about.
Without Tracy's help, I know I would not be here today. I would not have survived the lifestyle I was living.
We need to provide hope to our patients without these unnecessary restrictions.
Texans need access to health care, and we cannot afford to wait.
We can't solve this healthcare crisis without providers caring for patients in their own communities.
Please help us remove all barriers to health care for all Texans.